There are several psychological concepts that support the idea that manifesting and the power of words can influence our thoughts, behaviors, and outcomes. If you want to learn whether manifestation and positive affirmations truly work, then this video is for you. In this video, we will explore these key concepts and uncover the science or philosophy behind them. Let's start with the self-fulfilling prophecy. The self-fulfilling prophecy is a psychological phenomenon where a person's expectations about a situation or another person can lead to the fulfillment of those expectations. For example, if you believe you will succeed in a task, your confidence and behaviors might increase the likelihood of success. In 1948, Robert Merton coined the term self-fulfilling prophecy to describe a false definition of the situation evoking a new behavior which makes the originally false conception come true. What happens in self-fulfilling prophecy is that a person's belief makes reality conform to that belief. In most cases, the individual does not realize their own belief, which has helped to construct that reality, because their belief is eventually validated. They assume that it had been true at the outset. For example, a teacher who believes that a certain student is intelligent and capable may end up paying extra attention to this student, not knowing that this added attention makes the student work harder, wanting to impress the teacher. In the end, the student will outperform most of the other students, and the teacher's belief will be validated. Another example is if you interact with someone based on the belief that they already like you, this person may return your kindness and warmth, eventually validating your belief. Why does the self-fulfilling prophecy work? One of the principles behind self-fulfilling prophecy is behavioral confirmation. People tend to act in ways that confirm their expectations. If you believe you will succeed in a task, your increased confidence can lead to greater effort, persistence, and problem-solving, enhancing the likelihood of success. Another principle of self-fulfilling prophecy is perceptual bias. Expectations can influence how we interpret and remember information. If you expect someone to be friendly, you are more likely to notice and remember their friendly behaviors while discounting any unfriendly actions. Another mechanism behind self-fulfilling prophecy is emotional impact. Positive expectations can reduce anxiety and increase self-efficacy, which is the belief in one's ability to succeed. This leads to better performance. Conversely, negative expectations can lead to self-doubt and decreased performance. Ultimately, by being aware of self-fulfilling prophecies, we can consciously choose to cultivate positive expectations in ourselves and others. This can lead to more favorable outcomes and foster a growth-oriented environment. Individuals can use the power of positive expectations to improve their own performance and personal growth by believing in their capabilities and potential for success. The second principle in support of manifestation is the placebo effect. In some clinical trials, the researchers will assign the patients into two groups. One group receives the drug being studied while the other group receives the placebo, usually a sugar pill. Studies have shown that in many cases, most patients from the group that receive the sugar pill, the placebo, will start to feel better even though they took no medication. This phenomenon has come to be known as the placebo effect. The placebo effect is a fascinating psychological and physiological phenomenon where a person experiences a real improvement in their condition after receiving a treatment that has no therapeutic effect. This improvement occurs purely because the individual believes that the treatment will work. The placebo effect highlights the significant impact of belief, expectation, and perception on health and well-being. At the core of the placebo effect lies the patient's belief and expectation that the treatment will help them. This belief can be influenced by various factors, such as the appearance of the treatment in terms of a pill's color or shape or the manner in which it is administered, and the credibility of the healthcare provider. Despite the treatment having no active ingredients or therapeutic properties, the belief in its efficacy can trigger real physiological responses. This can include the release of endorphins, the body's natural painkillers, changes in blood pressure, heart rate, and even measurable improvements in symptoms. Several psychological mechanisms contribute to the placebo effect, including conditioning. Past experiences with effective treatments can condition patients to expect relief from similar treatments in the future. Motivation, a strong desire to feel better, can enhance the placebo effect. Reduction of anxiety, belief in the treatment can reduce anxiety and stress, which in turn can alleviate symptoms. Why the placebo effect works. There are 4 principles behind the fact that placebos make patients feel better even though they have no medicinal value. One of these principles is neurobiological changes. The placebo effect can induce real changes in the brain. Neuroimaging studies have shown that placebos can activate brain regions involved in pain perception, emotional regulation, and stress response. For instance, placebos can increase the release of dopamine and endogenous opioids, which are involved in pain relief and pleasure. Expectancy theory is another principle in support of the placebo effect. This theory suggests that the expectation of improvement can lead to cognitive and physiological changes that bring about actual improvements. When patients expect to feel better, their brains and body respond in ways that align with those expectations. Classical conditioning is also implicated in the placebo effect. If a patient has previously experienced relief from a certain treatment, they can be conditioned to experience similar relief from a placebo that mimics that treatment. The body's conditioned response can produce real physiological effects. Another possible reason why the placebo effect works is its reduction in stress and anxiety. Believing in the efficacy of a treatment has been shown to reduce stress and anxiety. Stress and anxiety are known to exacerbate various medical conditions. Therefore, the reduction in stress and anxiety can lead to symptom relief. The placebo effect underscores the profound connection between mind and body. It illustrates how belief, expectation, and perception can influence physical and psychological health. By understanding and leveraging the placebo effect, healthcare providers can improve patient outcomes, enhance the efficacy of treatments, and provide more holistic care. However, ethical considerations must always be taken into account to maintain patient trust and integrity in medical practice. The third principle in support of manifestation is positive affirmations. Positive affirmations involve the practice of repeating uplifting and encouraging statements about oneself, with the aim of fostering positive thinking, self-esteem, and motivation. Repeatedly affirming positive statements about oneself can help to rewire negative thought patterns and increase self-esteem and motivation. Cognitive behavioral therapy (CBT) often incorporates affirmations to challenge and change helpful cognitive distortions. Positive affirmations are short, positive statements that are intended to challenge and overcome negative thoughts and self-sabotaging behaviors. They are usually formulated in the present tense, emphasizing positive outcomes and attributes. The main goals of positive affirmations include rewiring negative thought patterns, enhancing self-esteem, increased motivation and optimism, promoting a positive self-image and outlook on life. Why do positive affirmations work? One reason is neuroplasticity. The brain has the ability to reorganize itself by forming new neural connections. Positive affirmations can help to create and strengthen neural pathways associated with positive thoughts and self-beliefs. With time, this will reduce the dominance of negative patterns. Positive affirmations also work because of cognitive restructuring. Cognitive restructuring is a core component of CBT, where negative and irrational thoughts are identified, challenged, and replaced with more positive and realistic ones. Affirmations can serve as a practical tool in this restructuring process. Self-perception theory is another principle that supports positive affirmations. According to this theory, individuals develop their attitudes by observing their own behavior and concluding what attitudes must have caused them. Repeatedly stating affirmations can lead individuals to align their self-perceptions with the content of the affirmations. Research has shown that positive self-affirmations can improve performance under stress, enhance problem-solving abilities, and promote a healthier lifestyle. Similar to the placebo effect, the efficacy of affirmations can partly be attributed to the power of belief and expectation. If individuals believe that affirmations will make a difference, they're more likely to see positive outcomes. The fifth principle in support of manifestations is visualization and mental rehearsal. Visualization and mental rehearsal are powerful techniques used by athletes, performers, and individuals in various fields to enhance performance, build confidence, and reduce anxiety. These practices involve creating vivid mental images of successful outcomes and repeatedly rehearsing them in the mind. Research in neuroscience supports the effectiveness of these techniques, showing that the brain can activate similar neural pathways during mental rehearsal as it does during actual physical performance. Visualization and mental rehearsals require two things. 1. Visualization, the practice of forming detailed mental images of performing a task or achieving a goal. 2. Mental rehearsal, the cognitive process of practicing a task or sequence of actions in the mind without physical movement. The purpose of visualization and mental rehearsal includes enhancing performance in sports, arts, and other fields, increasing confidence and self-efficacy, reducing performance-related anxiety and stress, improve focus and concentration, facilitating skill acquisition and mastery. Why visualization and mental rehearsals work? One reason why visualization works is neural activation. Neuroscience research shows that visualization and mental rehearsal can activate the same neural pathways in the brain that are engaged during actual physical performance. This means that mentally practicing a skill can strengthen the neural circuits associated with that skill, leading to improved physical performance. Visualization also works because it has psychological benefits such as confidence boost. By repeatedly visualizing successful outcomes, individuals can build confidence in their abilities, which can translate into better performance. It also leads to anxiety reduction. Visualization can help reduce anxiety by allowing individuals to mentally prepare for and manage stressful situations, making them feel more in control. Visualization also increases focus and concentration. Mental rehearsal helps individuals to concentrate on the task at hand, improving focus and reducing distractions. With regular practice and a positive focus, visualization and mental rehearsal can be valuable tools for achieving personal and professional goals. The last principle behind manifestation is self-talk. Self-talk refers to the internal dialogue that occurs within our minds. This inner conversation can significantly influence our emotions, behaviors, and overall mental health. Self-talk can be positive, encouraging, motivating, or negative, leading to anxiety, self-doubt, and other detrimental effects. Self-talk is the act of talking to oneself, either out loud or silently in one's mind. It encompasses the thoughts and beliefs we hold about ourselves and our experiences. Psychological studies have shown that positive self-talk can enhance performance in sports, academics, and other areas by boosting confidence and reducing anxiety. Cognitive behavioral therapy often incorporates techniques to modify self-talk. Therapists help clients identify and challenge negative self-talk patterns and replace them with positive alternatives. Neuroimaging studies have found that positive self-talk can activate brain regions associated with reward and positive emotions, while negative self-talk can activate areas related to stress and negative emotions. Self-talk influences cognitive processes by shaping our perceptions and interpretations of events. Positive self-talk can lead to more constructive and optimistic interpretations, while negative self-talk can result in distorted and pessimistic views. The content of our self-talk directly affects our emotional state. Positive self-talk can generate feelings of confidence, motivation, and happiness, whereas negative self-talk can trigger anxiety, sadness, and frustration. Self-talk also has significant behavioral influence. Our internal dialogue can drive our behavior. Positive self-talk can encourage proactive and resilient actions, while negative self-talk can lead to avoidance, procrastination, and other counterproductive behaviors. Self-talk is a powerful tool that can significantly influence our emotions, behaviors, and overall mental health. By becoming aware of our self-talk patterns and actively working to foster positive self-dialogue, we can improve ourselves. We have confirmed that there is power in your words and that manifestation works. Here are some tips for effective positive affirmations. Number 1. Consistency. Regular, daily practice is crucial for affirmations to be effective. Repetition helps to embed these positive statements in the subconscious mind. Number 2. Believability. Affirmations should be believable and realistic. Overly grandiose statements can sometimes be counterproductive if they feel too disconnected from one's current reality. Number 3. Personalization. Tailoring affirmations to address specific negative thoughts and challenges can increase their impact. Number 4. Visualization. Combining affirmations with visualization techniques can enhance their effectiveness. Imagining oneself succeeding in embodying the affirmations can make them more powerful. Positive affirmations are a simple yet powerful tool that can help rewire negative thought patterns and improve self-esteem, motivation, and overall mental health. By integrating affirmations into daily practice and therapeutic techniques like CBT, individuals can foster a more positive and resilient mindset, ultimately leading to better psychological well-being and personal growth. Good luck!